let's talk about your background, because you've been with Hartford. You've been at the helm, steward, for over 21 years, and you've been in healthcare for a long time. Even though you look pretty good, I will say. You haven't aged in all the years I've interviewed you, but I want to hear about your journey and then lead into the concept of healthcare being a team sport and what that means.
Yeah, first of all, I had the privilege. I've been here 21 years at Hartford Healthcare, which is the blessing and a privilege of a lifetime. For the majority of my first 13 years, our CEO, Elliot Joseph, did an absolutely extraordinary job building Hartford Healthcare, brought a vision to create this health system, and I was able to serve as his chief operating officer for that time period. For the last 6+ years, being the CEO has been just an amazing opportunity because, Robert, I'm from Connecticut originally. My parents were public school teachers. My dad taught for 43 years in Connecticut. My mom taught for 35 years. My sister is a public school teacher in Connecticut. So I come from a family that cares deeply about public service, that cares deeply about community, and that has spent the greater aspects of our lives trying to help make Connecticut better, right, and change people's lives. So for me, I've had tremendous good fortune. I did my graduate work in Washington, D.C. at George Washington University, and GW changed my life. Had the opportunity to go work in Detroit at the Detroit Medical Center, where I met Elliot Joseph. In fact, we both worked there together. And I had tremendously important formative years working in Detroit, learning really at the seat of extraordinary leaders at the Detroit Medical Center, in one of the most progressive and pioneering healthcare markets in the country. And then I had the great privilege of working in Manhattan, in New York City, for 6+ years, having an opportunity to work amongst, the leading academic medical centers in the world, in really the world's capital. So in that time period, Robert, I had a very defining moment. I was on September 11th in 2001 at St. Vincent's as part of the leadership team, which was the responding hospital. And that has shaped my entire perspective on healthcare, on the importance of hospitals and health systems and the role they play in the community, around readiness, preparedness, and around service. So I've had great good fortune. And then almost immediately after becoming CEO of Hartford Healthcare, March of 2020 happened 6-7 months later, and we found ourselves in COVID. So really, in many ways, the defining kind of goalposts of my career was really serving as the primary responding institution to 9/11, and then more recently helping lead the efforts in the state of Connecticut to respond to COVID. So I've had great fortune to be able to be in the right place to contribute, to our communities in times of great need.
And explain the concept of it being the ultimate team sport. Why is healthcare the ultimate team sport? And if someone is listening in and they're not in healthcare, is there something they could learn from being a team sport?
Gosh, I'll tell you, it really is the ultimate team sport. First of all, talk about 9/11 for a moment. I mean, we never saw greater teamwork, greater selflessness, greater service than we did in those moments. And certainly during COVID, it was exactly the same thing, even for a more prolonged period of time. Every day, if you look in our operating rooms and you see some of the world's greatest surgeons and proceduralists, those people are supported by teams of circulators, nurses, physician assistants, advanced practitioners, anesthesiologists, CRNAs, central sterile supply, environmental services, biomedical engineers, facility engineers, schedulers, registration experts, people who work in billing, people who work, across the PACU and recovery areas. I mean, I could go on and on and on, Robert, about the hundreds of people who have to come together and work with tremendous precision and collaboration and coordination to make that one event, that singular procedure or surgery, a success and safe event. So healthcare is the ultimate team sport. It's people coming from all backgrounds, all types of training capabilities, all types of purposes to come to the purpose, right? Which is for caring for people, taking care of our community, being here, being ready, and ensuring we do it in the safest, highest quality way. So I value and respect teamwork above all else. And it really is the notion that each person's role is crucial and critical. Each person's contribution is immense to get the outcome and to get things like, that recognition for our really national leading quality that we produce. It's because there's 45,000 people come together to do that, and every person, no one more important than the other.